Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this learning project that you will surely love. Hypnosis is a powerful technique with which you can help and improve the quality of life of a large number of your patients. Remember to read the description of this video, where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. Let's see an index of what we will see in this and in the next videos. Clinical hypnosis or hypnotherapy in this video. Direct clinical hypnosis. Classical hypnosis or Erickson hypnosis. AutoHypnosis. Regressive hypnosis. Rapid hypnosis. Spectacle or theatrical hypnosis. Traditional or suggestion hypnosis. Cognitive behavioral hypnosis. Neurolinguistic programming, NLP. Hypnosis is a tool of psychology that deals with the psyche. It is very difficult, practically impossible to say how and who started hypnosis. But like psychology, hypnosis has a short history, but has a very long prehistory, as we have seen in the previous videos. What is hypnosis? The word hypnosis has its origin in hypno, in Greek mythology hypnos, was the personification of sleep, son of Erebus and Nyx, and twin brother of Thanatos. Sys, suffix meaning action, process or result of. Hypnosis is a tool of psychology that deals with the psyche. It is very difficult, practically impossible to say how and who started hypnosis. But like psychology, hypnosis has a short history, but it has a very long prehistory, as we have seen in previous videos. We call this technique hypnosis since a Scottish surgeon named Braid assimilated in a shocking way with Hypnos, twin brother of Thanatos, whom the Greeks considered the gods of death. The first mention in Spain of hypnosis techniques is related to the application in medicine by Ramón y Cajal, Nobel Prize for Medicine in 1906, then professor of anatomy in Valencia in 1886. We want to make it very clear that hypnosis is not by itself therapeutic, that is to say, it is not therapy. Hypnosis is a state in which we can apply a therapy. Once we reach this state, this will be the starting point for the application of a psychological hypnotherapy or psychological hypothermy therapy. Then we will be able to take advantage of this state to improve states of anxiety, stress, migraines, etc. Hypnosis as a therapeutic tool is the oldest known technique to provoke a change in behavior, perception, and emotional in human beings. Nowadays, thanks to the great advances in neuroscience and the device technique in neuroimaging, it can be conclusively assured that hypnosis provokes measurable modifications in the central nervous system, CNS, and peripheral nervous system, PNS. We are also susceptible to be hypnotized. The difference is that some are more susceptible and others are less susceptible to be hypnotized. From the most remote times, the use of the natural was always maintained as a general rule to treat any disease. When it comes to healthcare, man has been concerned about maintaining a balance between wellness and health. Hypnosis is a millenary option for healthcare, which is currently recognized as having numerous medical utilities. Everything that is outside our consciousness is reflected in our body. The body is the window or mirror of our unconscious. All our emotional history is engraved there. Hypnosis is the key to the basement of our being, to what is below, what is not seen, the unconscious of the patient. Why are we distrustful of the unknown? Are we cowards? There are hundreds of millenary techniques and alternative medicine that today are beginning to be known. Why have we taken so long to give them our trust? Yoga, traditional Chinese medicine, natural medicine, acupuncture, reflexology, Bach flower essence, Tai Chi Chuan, Reiki, Shiatsu, aromatherapy, homeopathy, chromotherapy, chemotherapy, naturopathy, chiropractic, noisy therapy. First noisy baby was a girl born on February 14, 1973. Emotional healing, etc. In our limited life, only love and dedication will make us move forward. Fear is the antonym, and it is what will confuse us, what makes us stop. Why are we afraid? Since when have we been afraid? When we will be free and stop living without fear? Clinical hypnosis is one of the most demanded alternative therapies nowadays. Its application extends from dentistry, traumatology, psychotherapy, to oncology itself. Its application with the current technique has no side effects, make it a clean, fast and effective therapy. Its almost overflowing growth produces a strong demand for specialized therapists trained in this area. Clinical hypnosis helps us to penetrate the deepest and most recounted parts of the mind of the human being, there where our conscious mind is forbidden to go. To those blocked memories of our earliest childhood, which conditioned us so much. At therapeutic level, it is totally verified that the clinical hypnosis is a technique of enormous utility in the treatment of many imbalances of psychological type, hypnotherapy, like anxiety, depressions, stress, phobias, nervous tics, insomnia, addictions, etc. Psychosomatic disorders such as asthma, gastrointestinal problems, dermatological problems, etc. Dissociative disorders such as multiple personality, fugues, conversions, etc. And of physical type, hypothermia, such as muscular injuries, reactivation of malfunctioning organs, joints, etc. And it is also especially indicated in carcinomas. It has been demonstrated with several studies that if we visualize with a brain scanner the encephalic activity of a patient submitted to a session of hypnosis, we observe that the cerebral area that provokes the pain signals, primary sensorial cortex, has a very reduced activity, and the area that blocks the painful signals, anterior cingulate cortex and the basal ganglia, are much more active. Therefore, this shows that hypnosis prevents pain signals from reaching the parts of the brain where they are processed. Hypnoid hyperthermia, hypnophysiotherapy, is a very modern technique transferred from medical electromagnetic hypothermia to clinical hypnosis. This technique has a great repercussion at international level in the field of professional hypnotherapy, revealing itself as an effective alternative for very serious psychological pathologies, especially in oncology. Every night before going to sleep, we enter a hypnotic process, 6 stages of sleep. Relaxation, REM, rapid eye movement, REM. The brain begins to emit a series of waves and the body disinhibits the conscious. This is what we are going to try with modern tools such as with systematic relaxation, Saltz plus Jacobson. Effects. The conscious is inhibited and the unconscious is free. Ratio 20 drop 80%, more or less. We remain conscious at all times. See anatomy of the brain. It increases suggestibility, leaving the unconscious that controls the instinctive parts without the sensory barrier of the conscious, if the moral code of the patient is not touched. If all the sensory elements are closed except the auditory one, the conscious, as the analyst and rational that it is, presents a cortical sensor barrier, which oversees evaluating whether everything enters in a reasonable way or not. However, a technique can be established by means of which the conscious can be made to believe that it is entering a sleep phase. The conscious is inhibited, and the subconscious takes over. Then, if under these circumstances and situations and information is introduced, it could cross the sensor cortical barrier and pass to the subconscious and enter the memory. Since the conscious believes that it is in the dream phase and let it enter the memory without discussing the mentioned information, that is, it leaves the conscious out of play, so that our capacity for logic, reasoning, calculation is inhibited, leaving everything to the control of the unconscious that has no sensor cortical barrier. Therefore, everything that is heard enters through the unconscious. But this is emotional. It cannot calculate by logic or reasoning, so it does not matter if what is said is true or false, if it is right or wrong, if it is exaggerated or not, if it is proportionate or disproportionate. He will only comply with what he has been told, if it does not go against the patient's moral codes. Consequently, all the inductions we make will enter via the unconscious, which does not calculate, does not reason logically, and therefore enters directly into the memory. There is a direct relationship between easy entry into hypnosis and A. Intelligence, B. Surrender. The more intelligent, more suggestible, as it usually lacks fears. The more you surrender, fewer sessions and better results. Contrary to popular belief, people of lower IQ are infinitely more difficult to hypnotize, while those of higher intelligence are much easier to hypnotize. This is due to their greater ease of conceptualization and because they are more likely to overcome fears and reluctance that can block the hypnotic process. What is the worst that can happen? Nothing. There are no known side effects or incapabilities. The worst would be that the patient falls asleep. If this happened, the session would be considered as lost. Definition of clinical hypnosis. After writing numerous articles on psychology and clinical hypnosis, devoting several years to research, and this our second book on hypnosis, we have dared to design our own definition of what we understand clinical hypnosis to be. Definition. Hypnosis is a technique that allows us to access the unconscious. By means of this technique, we deceive the patient's conscious, making him or her believe that he or she is going to sleep. In this way, the conscious is inhibited, and the unconscious is disinhibited. Once this is achieved, we work and operate with the unconscious to alleviate, cure, or accelerate the healing of symptoms, disorders, or diseases, both psychic and physical, always respecting the moral code of the patient. Therefore, hypnosis is a natural state provoked in an artificial way. Hypnosis is a science that should always be used for therapeutic purposes. Clinical hypnosis seeks the healing of the patient, and does so where it can be faster, more effective, and permanent. That is, working directly in the unconscious part of the patient in order to alleviate, cure, or accelerate the healing of symptoms, disorders, or disease, both psychic and physical. Hypnosis then would be the key to access the unconscious of the mind of the human being. Hypnosis would be an exercise of concentration and a well-done story. A. Concentration. It consists of isolating the patient from his environment in a voluntary and gratifying way, through focusing his attention on the indications directed by the hypnotherapist, consisting of gradually introducing the patient in the successive levels of deepening. This would be means to achieve the objective of entering and remaining in level 1 and prepared for further deepening. Well-done story. This section would integrate the speeches tending to visualizations aimed at maximum deepening and which are the basis for entering levels 2 and 3. For any of them, it is of utmost importance that the individual is adequately prepared, through information about what hypnosis is and is not, to respond to the session through his imagination, his will, his memory, his intelligence, and his visualization capacity. We will try to compile all the techniques that we know about it, forming a range of possibilities as wide as possible, treating them in a particular way, each one of them, and separately to be able to apply them in the most appropriate way and form. We must learn to think and decide for ourselves. For example, in the Middle Ages, to the so-called madmen. In the Arab culture, they were defended. They were Allah's chosen ones. In the Christian culture, they were possessed by the devil. The solution was the stake, especially if they were female. Worldwide, the most prominent countries are Argentina, USA, Spain, England. Spain and Argentina are at the forefront in research level of professionals, congresses, etc. But hypnosis is not. TV programs, circus-type shows, tales and stories we have heard about hypnotized people who do not know what they are doing, or do barbarities against their most elementary principles. There are many fables, movies, or hoaxes. Hypnosis as a therapeutic procedure can be considered as one of the oldest techniques known. However, despite its antiquity, it has had periods of oblivion and others of great acceptance. These situations of oblivion have been given mainly by the great ignorance about hypnosis, which has been considered for a long time as a scientific procedure. It has also been surrounded by a mystical veil, attributing special, almost magical powers to the practitioners of hypnosis. This led to its non-acceptance in those periods of oblivion, although today there are also many detractors. In the second half of the 20th century, the period of scientific hypnosis began. Nowadays, we are in a period of acceptance of hypnosis, especially of clinical hypnosis, and not of circus or show hypnosis. Applications of hypnosis. Basically, any psychopathological problem has been attempted to be remitted by means of hypnosis, although the rates of effectiveness have been variable and sometimes contradictory over time. In line also with the heterogeneity of hypnotic practice, the homogenization of clinical hypnosis in recent years has allowed to reveal an irrefutable cause history as to its value and therapeutic efficacy. Among the most documented applications are pain control, addictive disorders, habits, smoking, eating, cognitive restructuring, psychosomatic disorders, asthma, gastrointestinal, dermatological, post-traumatic stress, anxiety, phobias, insomnia, dissociative disorders, fugues, conversions, multiple personality, and others. It is known that in the hypnotic state, certain neuronal concentrations of the cortex are inhibited, while others are stimulated, due to the electronic monitoring that can currently be performed by means of digital electroencephalographs, global response polymonitors and psychological monitors, blood pressure monitors, electrocardiographs, and muscle response meters. If you are interested in learning more about clinical hypnosis, please watch our next video, What is Direct Clinical Hypnosis? If you have questions, ask them in the comments area. On this topic and many others, we will talk about in the channel and in the videos that we will publish. So if you are interested, do not miss our next videos. Thank you very much.